Our topic today, inshallah, will be about maternal testing. So, when a pregnant woman comes to a hospital during first trimester, there are a number of tests should be done for her. We will talk in this lab about pre and post-partum tests, and we will explain them and their importance. We will talk about RhIG and what is RhIG, what's the importance of it, and who's candidate to have RhIG. Also, we will talk about number of techniques. We will talk about elution, adsorption, and also auto-adsorption technique, and we will understand their principles. We will talk about antibody titration, intra-uterine transfusion criteria, which will be around the criteria of blood that we have to choose it for pregnant. We have to choose it to do intra-uterine transfusion. So, pregnant women, when come to the hospital, they ask her to do we take number of samples from her. Okay, so because we want to do number of tests. So, for example, for any pregnant woman, we have to determine an ABO. What do you think? Why? And so looking for RhD. What do you think?
الRhIG عشان لو كان في اختلاف بين فصيلتها وفصيلته عشان نمنع hemolytic disease of newborn.
Excellent. So here we want to know if she is negative, okay, because negative women at a risk of having baby with hemolytic disease of newborn. Excellent, Hadil. Okay. Admira Noura. طيب, what about the ABO? Why we need to determine the ABO? ممكن. Excellent. Aisha said we may need transfusion for this woman. What else? Did you have an idea about ABO incompatibility between the mother and the baby? Is there a chance to have incompatibility between the mother and baby regarding to ABO system? What do you think? هل ممكن يصير
Yes, ممكن. إيه ممكن.
Excellent.
ولا يصير للبيبي شيء.
طيب أخذتوا ليش ممكن ما يصير للبيبي شيء؟ Excellent. So usually the severe hemolytic transfusion reaction is result from present of a low antibody, and usually the most common one is anti-D. Okay, is the anti-D. However, it can be anti-small c. This is the most common anti-big K, and also it may happen as a result of different antibodies, but this is the most common. So on these antibodies, we don't see the anti-A or anti-B. So or anti-B. So what do you think? Why? So the severe cases is usually related with this. This is the most common. Okay. لكن عادة severe ما تكون مع الانتي A والانتي B. Why? What do you think?
لأنه IgM.
Okay, this is one reason. Okay, but some of them. Okay, so some of that we have to put in our mind. Yes, most of anti-A and anti-B or ABO antibodies are from IgM, isn't it? However, there are sometimes we have also IgG antibodies. Especially we have anti-A and anti-B from this class in mother from O type. Okay, so mother from O type may have anti-A and anti-B from IgG class. So in this case, what do you think will happen? توقع عم بيصير.
Cross the placenta.
Yes, it can cross the placenta. Okay. However, it still don't cause severe hemolytic disease of newborn. مين تقدر تقولي ليش ما تصير severe؟ يلا اربطوا. Link your information together. You already have the knowledge, but try to link it together. What do you think? Huh?
أتوقع عشان ال expression of الجين ال ABO genes ما يكون قوي.
Excellent. This is one reason. Excellent. This is one reason that it may be poorly expressed on the cell. However, it is expressed but not strong. Okay. What else? So this is one reason. So unlike D, it's expressed, and also big K, for example, it's expressed very well on the baby or a newborn RBC. However, ABO, it's not well developed at birth or before that, of course. So this is one reason. What else? And you said much of them is IgM. Yes, okay, we can consider this as the reason. Okay, so third reason will be what? There are subtypes of IgG. Okay, so it's quite something different. Can you remember this is the RBC? So the ABO antibody antigen is present on the surface of the RBC cell, but also present at different places, isn't it? تتذكرون الانتيجين حقت A and B antigen present where? It's poorly expressed in the platelets. But what else? الRBC صح on also tissue and organ extension وهديل. What else? تذكرون كمان وين موجودة؟ يلا في ما قلتوها. It's present as a free antigen on the plasma. Yes, Shayma, it's present as a free antigen on the plasma. طيب. So what will happen if the antibody is across the placenta and go to the baby circulation? What will happen? It will interact with the free antigen. It will interact free antigen, which lead to neutralize the antibody. So the antibody will be neutralized. So it will, most of them will not bind to the RBC, leading to destroy of the cell. It will be neutralized by free antigen on the serum. So this is why ABO incompatibility between mother and father, it's not usually causing severe hemolytic disease of newborn. Comparing with the D mainly present on the RBC, isn't it? So anti-D will bind to it directly. Okay, so it will not neutralize by free antigen لأن أصلا ما عندنا free D antigen on the plasma. Okay, so it will not neutralize. It will cause destroy cell. So this is why it can why anti-D can cause severe hemolytic disease of newborn, while ABO incompatibility usually, if they cause mild hemolytic disease of newborn. Okay, so it's very important to know the ABO and the type of the mother. Also, we have to do antibody screening. Why we have to do antibody screening test for them? ايش رايكم؟ Compatibility. And I'm looking for antigen now. Why? To detect an excellent role. I want to detect an unexpected antibody. But what if we recognize that this patient, for example, have anti-D? Okay, what we will do? So in case if the woman already developed the antibody, okay, we have to know if she already have or not. How can we do that or know that? By doing an antibody screening test. So we are looking for unexpected antibody, and when we found it, okay, we have to do an identification. We have to do an antibody identification test. to know the specificity of this antibody. So if it's, for example, from IgG class, that means the baby is at risk, isn't it? Then in case of incompatibility, this antibody may cross the placenta and cause hemolytic disease born. However, if the antibody is from IgM, okay, we don't expect this antibody to cause hemolytic disease of a newborn. Type. So we have to evaluate the antibody to know if it's clinically significant antibody or not. So we have to know the specificity of this antibody by the antibody identification test. Type. If we detect, then first we start with antibody screening. It gives us positive result. When we do antibody identification, we find, for example, it's anti-D. So anti-D is from IgM, so it's clinically significant, and also we know that it can cause severe hemolytic of newborn. So what's the next step? So the next step, we have to do titration. طيب التitration will tell me at different time. يعني الشهر الأول تجي، الشهر الثاني، الشهر بين فترة وفترة لازم تجي to check the constant or the titration of the antibody to see if the titer is increased by the time or not. طيب إذا صار increasing by the time, هذا is it a good sign? Dad, is it a good sign?
لا.
Excellent. No, because that means the mother body start to react with something. It's react with, of course, in this case, baby. So it's not a good sign. So we will discuss this, inshallah, in details. Okay, so we understand now why we have to do these tests. Okay. طيب. Let's talk now about RhIG. So we understand, or we talk about different tests that we have to do to pregnant women. طبعا ما تدري، هي تجي تعطي دم وتروح ما تدري وش اللي قاعد يصير. now we understand the test we have to do for her and why we do this different test. طيب. So let's talk about RhIG. في أحد سمع منكم بالRhIG؟ Have you heard about RhIG before? Or yes, أشواق, injection give it to pregnant women. So we will explain it. So maybe you don't have an idea about it. So RhIG, it's injection. Okay, it's anti-D. This is anti-D is given to pregnant women from D negative type in order to protect her from being sensitized. We don't want D negative women to develop anti-D. So they found when a pregnant woman from D negative, okay, when we give her a ready-made antibody, ready-made anti-D, we found this protect her from being sensitized. Okay, so during pregnancy, okay, during pregnancy, there are some blood cells escape from baby circulation inside mother circulation. Okay, so this is why pregnant women may sensitized. Okay, so we call fetal maternal hemorrhage. So in fetal maternal hemorrhage, okay, there are some blood escape from baby or fetus to the mother. So in the mother immune system recognize the presence of foreign antigen or foreign RBC with foreign antigen, it may produce antibody against these antigen. Okay, so so this may happen normally during pregnancy, or sometimes إذا كان في يعني صار في accident, في trauma or whatever during pregnancy. So this is first chance to have fetal maternal hemorrhage during pregnancy. Okay, so they recognize that at 28 weeks gestation, there are possibility to have fetal maternal hemorrhage. Okay, so at this time, this is first time to protect the woman from being sensitized. A second time during delivery. During delivery, there are also exchange blood between the baby and the mother during delivery. Okay, we expect large amount of blood to go inside the mother circulation. So this is the second time of contamination that happened. طيب, let's see now. So NTD RhIG, the first time to give is at 28th week gestation. Okay, and the second time we have to give the pregnant woman after delivery within 72 hours. Within 72 hours, because during delivery, as we said, there are fetal-maternal hemorrhage. Okay, طيب, who is candidate to have this RhIG? مين تتوقعون هذا الرقم أعطيه أي وحدة حامل؟ قلنا مين نعطيها؟ What's the kind of candidate of a pregnant woman that should receive a RhIG? Do you think be positive woman?
D negative woman.
Excellent. So this is the first thing. It should be negative. Okay. Excellent, all of you. So mashallah, Lulwa said something else. Lulwa said not previously exposed to the antigen. So in a specific, I think Lulwa means it shouldn't be sensitized. So since the first things, it should be from negative. Okay. Also, it should not have anti-D in her circulation. Okay. ليش لما يكون فيها anti-D هل توقعون الرقم المين aim of RhIG to protect women from producing anti-D, isn't it? So if a woman already have anti-D, do you think is it يعني logic to give her anti-D?
No.
خلاص نقول سبق السيف العذل ما عاد نقدر. So she already now sensitized, so we cannot, or there are no benefit from give her this RhIG. Okay, so it should be negative woman and also not sensitized before with D. So don't have anti-D in her circulation. So we want to protect her from the beginning. Okay, من أول حمل لازم ننتبه. عشان كده دائما نقول يعني إذا كان في إيفنتات ولا في أي شيء نحاول نوعي المجتمع بأهمية أن تكون المرأة نيجاتيف أيا كانت فصيلتها أي نيجاتيف أو نيجاتيف أو whatever، تنتبه من بداية حملها من أول حمل أنها تاخذ الرقم. ممكن هي تكون في مكان نائي أو تكون مثلا ما تتابع الحمل إلا في نهاية الحمل، الولادة قبل الولادة بفترة بسيطة تبدأ تتابع. نقول لهم لا، أنتم فئة خاصة، أنتم لازم تنتبهون لأنفسكم وتاخذون الرقم، لأن إذا تحسسوا okay when they develop an anti-D okay there are يعني possibility of having hemolytic disease of newborn from severe type. فليش ندخل في الكومبليكيشن هذه من البداية؟ نحاول أنها أصلا ما تطلع الانتي-D. okay, clear? Is this clear point?
Yes, clear.
Clear.
Okay. طيب, Lujane, are you with us? Lujane, what do you think if we have, or if we do screening test and we recognize that this woman develop anti-small c, for example, do you think it's valuable to give her RhIG? هي عندها anti-C, sorry. So there are no need to give her RhIG. Anyone have a different idea? So she is negative, but she already developed anti-C. Excellent, Ashwa. Can you explain to us? Hood also. Anyone of you can explain why? Yeah, why? طب هي عندها anti-C. هل نعطيها RhIG؟ لا، ما عندها RhIG. لا ما عندها انتي دي، لكن هي نيجاتيف. هل اعطيها الروجام ولا ما اعطيها؟ ايش رايكم؟ اعطيها اكسلنت. اوكي، هي عندها انتي سي. اوكي، الانتي سي الروجام اصلا مخصص ان protect from develop anti D isn't it؟ فهي ما عندها الانتي دي. اوكي، so she's candidate to receive the روجام. اوكي، ما نقول خلاص هي خاربة عندها انتي سي خلي تطلع انتي دي. اوكي، so she already have anti-C but don't have anti-D yet, so yes she is candidate to receive. طيب الحين نرجع اشتغل. So in this case if she already sensitized with antibody but not D, that means she still candidate to have RhIG. Okay, so if she developed, for example, anti-Duffy A, okay, it's okay to give her, but she's negative, for example, being negative, it's still candidate to receive الرقم. أهم شيء إنها ما تكون طلعت الأنتي D. Okay, clear this point? So it should be D negative woman, but don't develop الأنتي D. However, if she develop different type of antibody like anti-C or anti-whatever, is it okay to give her the program? Is it clear? Do you understand this point? Okay.
clear.
Good. So they found that around 300 microgram of RhIG, okay, can protect from 30 ml of baby blood. Okay, so if there are bleeding or fetal-maternal hemorrhage around 30 ml, one dose is enough to protect the woman from being sensitized. But just imagine that this mother have more than that. So if she have, for example, 100 ml of bleeding, so do you think 300 microgram dose is enough? No, she need more, isn't it? She need additional dose. So that means I have to know how much bleeding, isn't it? So I have to know how much bleeding. So in order to know how many doses she need 1 or 2 doses. طيب, how to do that? How to calculate or how to know how much of bleeding we have to do 2 different tests. We have a Rosette test. Okay, this is screening. Okay, so a screening test, it can be positive, it can be negative. So if it's negative, Rosette test, we do Rosette test and it's negative, that means 1 dose is enough. ما عندك مشكلة, 1 dose is enough. However, if we do the screening test and we will see now what is Rosette test and we get positive result, that means we have to do a confirmatory test, okay, which is Kelhauer-betke acid or acid elution test, okay. So in Kelhauer-betke acid elution test, we can calculate the exactly amount of bleeding. Okay, and also we will see and understand Kelhauer-betke test. طيب, there are also different method. Okay, they now shift to a different method, which is flow cytometry. Okay, so flow cytometry, we can use a flow cytometry technique to know how much of a bleeding has happened to this woman. So if we know how much, we can calculate how many doses she needs. Okay. Here again, we discussed this. We said the most severe cases usually caused by anti-D in first place, then anti-small c, then anti-big K. Okay, so this is most severe cases of hemolytic disease of newborn. However, the most common, okay, hemolytic disease of newborn, usually caused by ABO antibody. So this is common but not severe. This is common but not severe. فكثير في حتى الأم ممكن ما تعرف أن البيبي عنده hemolytic disease of newborn. هي بس وش تشوف فيه؟ إيش تتوقعون؟ تقول يا ربي كان ولادي الزينة بعد يوم أو يومين تغير. جندس excellent وعد. Okay. So they will have a jaundice. So if it's smelled, just the physician will ask her just to put it in under the sun or UV light. Okay. So this is common but not severe. However, in severe cases, there are certain tests we have to do. Okay, to protect, or procedure we have to do to protect البيشنت البيبي. اوكي. طيب الجندس عادة بعد ما يجي بعد الولادة على طول، يجي بعد يوم أو يومين، فهي تقول أنا يا ربي أول ما ولدت زين، بعد يوم أو يومين قلب لونها أصفر. ليش تتوقعون؟ هل كلامها صح ولا لا؟ توقعوا ملاحظاتها دقيقة ولا لا؟ تكسر اكسلنت. اسماء تقول تكسر الدم تراكم باليروبين. واي؟ طب ليش ما تكسر؟ ليش اول ما ولدتها كان كويس وبعدين تغير لونه بدأ يتراكم عنده باليروبين؟ واي؟
لأنه كان ياخذ من دم أمه في البداية يمكن.
اكسلنت. أمه تصفي له to be specific. okay. mother liver clear the bilirubin, conjugate excess bilirubin, so she protects her fetus. However, after delivery, the fetus or the baby have to depend on himself or on herself now. Okay, كان في بطن أمه هي شغالة، هي يعني ياخذ منها وهي تصفي له الدم وهي كل شيء، بس يطلع منها خلاص ويبدأ يعتمد على جسمه. Okay, and the liver it's not well developed at birth. Okay, so this is why it will not be able to dealing with high level of bilirubin. Okay, so need UV light or sunlight to conjugate the bilirubin, okay, and remove it from the circulation, because accumulation of bilirubin in a baby it's severe. It may accumulate in the brain. لا يدخل. شلون تغذيه؟ شيماء, if you think about it, how she can feed the baby? How can the baby live during the fetus life? So the mother nutrients and everything go to the baby circulation. Okay, and also we can find it. Okay, so if it's severe we have to do some procedure. Okay, if it's not severe زي ما قلنا الأبي عادة ما يكون severe حتى الأم ما تدري إنه فيه إن السبب هذا هو سبب الصفار اللي فيه، بس كم فترة كذا وبعدين خلاص يضبط أموره. however إذا كان severe لا يحتاج تدخل طبي. طيب let's move now to antibody titration. طيب so السبب الوحيد للجندس لا في أشياء كثيرة بس هذا أحدهم. okay. طيب so antibody titration, Anfal asks is this is the only reason? I think she means the only reason of jaundice. No, I think there are different reasons, but this is one of them اللي هو hemolytic disease of newborn as a result of maternal antibodies. So let's move to antibody titration. It's a quantitative determination of antibody concentration of serum. So it will not give me exactly, but it may give me range. Okay, so we expect titration to be more than that, this value, and less than this value. Okay, so in any semi-quantitative test, that means it will not give you exactly number. So it's not qualitative, so either positive or negative. لا, it's more specific, but however, it will not give you the exactly amount. So it will give you range. concentration. So this will help me, antibody titration help me to know the concentration of a specific antibody in patient serum. Okay, to know if the antibody titer is low or antibody titer is high. طيب, let's imagine that we have two different patient. Okay, ركزوا معي, عندي two different patient وكلهم عملت لهم antibody identification test وكلهم طلعوا لي anti K. واحد طلع لي +1, واحد طلع لي +3. Which one have higher titer than the other? استخدمت نفس البانل بس one patient A عطاني +3. Excellent. So the strength of the reaction is related to the titer. Okay, so the strength of the reaction is related to the titer. طيب ال clinical important عندي طيب الحين خلاص خلصنا. Let's move to different example. عندي two patient, واحد عنده anti K وعطاني +1, واحد طلع عنده IgM anti Lewis A. It's from IgM لكن عطاني +3. هل الانتي K is clinically significant more than Lewis A which is from IgM؟ مع أن هذا anti K +1, هذا anti K +1 وهذا Lewis is IgM +3. Which one is more clinically significant, الانتي K ولا الانتي Lewis؟ excellent. مع أن أعطاني التايتر كان نازل وهذاك أعلى لكن إحنا نقيم clinically significant by knowing the ability of the antibody to cause transfusion reaction, to cause or to reduce the lifespan of the red blood cell. Okay, so إذا نعرف أن كان reduce the lifespan of red blood cells, we consider them as clinically significant. If we know that it's from IgM, for example, and we know that this IgM, it's only called antibody and work at a very low temperature, we sometimes not consider them as clinically important. We consider them as benign antibody. طيب, excellent. Okay, so this concept, I hope it's clear now. طيب, let's back to the titration. So in titration, we talk about this application. So usually we do antibody titration for pregnant women. Okay, this is routine. However, we can also do it to measure the titer of anti-A and anti-B antibodies. Okay, this is in some, I can read it and I read previously that some blood bank centers do that. Okay, however, here we don't do that. We don't do titration, the anti-A or anti-B. Okay, we don't do it. However, some blood bank centers do titrate the anti-A and anti-B in people. Okay. So يشوفون مثلا ال O people هل عندهم الانتي A عالي؟ طبعا هم كلهم عندهم، احنا عارفين عندهم بس احنا نبي نشوف التايتر هل هو نازل ولا عالي. Okay. طيب. So if we want to do an antibody titration, we have to know, before we do antibody titration, we already know the specificity of the antibody. I have to know the specificity. لازم أعرف أصلا وش الانتيبودي اللي بيسوي titration. هل هو anti K؟ هل هو anti B؟ So what type of the antibody I dealing with? So if I know, for example, the antibody I deal with is anti B, so I have to consider the property of anti B. So does it need incubation time? So if we want to do titration of ABO type of ABO antibodies, does it need to be do it at in 37? No, it's cold. We know it's work at room temperature. Okay, so immediate span at room temperature, it's enough. Okay. Yes, excellent. Okay. طيب, if it's other antibody, so what the condition we have to provide it for our experiment or our test? It should be we have to run at, does it need incubation time? Yes, it need extent. It need incubation time at 37. Okay, وعلى حسب لو استخدمنا less incubation time ممكن يقل عندنا شوي. Okay, so also we need to add تذكرون ايش كمان؟ الفيز هنا لازم يكون على indirect phase. So 37 incubation time unless of course we shouldn't forget adding الCOMS reagent. Okay, so we have to consider the properties or the factors that we have to provide it for our experiment. Okay, so if test pregnant female, so if we recognize that this particular woman, for example, have Duffy A, okay, or NTD or whatever, okay, we have to do a titration at different time. Okay, so we have to do it. So each 4 weeks, for example, or each 6 weeks, the pregnant woman should come back, and we have to take sample from her and looking for the titration. So maybe first time, for example, it is 16. So after 4 weeks, it may be increased to 64, for example. So we have to know the baseline, then compare it by the other or consequent test result. So if it's 16 and becomes 64, that means there are increase on the titer. Okay, as we said before, and this is not a good sign. This is mean the mother body produce more and more antibody in order to destroy the foreign antigen. مع الأسف الفورين antigen هنا في حالتنا هي البيبي cells. Okay. Yes. طيب. When we do الantibody titration, طيب رجع الآن؟
رجع.
طيب, so again, AABB recommend that we read a result from different direction. We will see it now and we will discuss why. Okay, so let's see. So if we do a dilution, so we have, for example, here, this is 2 patients. So this is sample 1, okay, and this is sample 2. So when we do a titration, we will discuss cell methods together, inshallah, and we will see that each time we will reduce the type. So in this condition, طيب الصوت يطلع عندكم؟
الحين نسمع.
طيب لأنه يطلع عندي إنه ضعيف. So in this situation, so here we have 2 different samples, sample 1 and sample 2. So each time we will test the sample or the serum number of time. Okay, so each time we dilute sample more. And if you remember in immunology course, you dilute several times. The current serial dilution, you do serial dilution, isn't it? So here it's the same. We will do serial dilution. So we will dilute our sample, which is serum. Okay, we will dilute them by using saline. Okay, so I will put saline in them and we will discuss the procedure, inshallah. Then we will add serum. Each time I will mix it, then transfer it. Okay, so each time the concentration will be reduced. Then we will add the RBC, which is our antigen, okay, to detect the effect of dilution. So for example, here we diluted the sample, okay, so it still gives me +4. increased dilution, we can see by increasing the dilution, the titer is decreased and until it stops here. Okay, the reaction is decreased. Okay, because we dilute الsample. كل مرة نخفف عدد الانتيبوديز. Okay, لما وصل at this and it become turned to 0. Okay, so how to know the titer? A titer is the reciprocal of the last tube give me positive result. So here in this case, the titer will be 64. 64. Excellent. Okay. طيب. Let's see sample number 2. So again, here in sample number 2, they diluted. So each time we can observe that the titration is decreased. And again, what's the titer here?
64.
Excellent. It's again 64. This method is as we calculate the titer by looking to the reciprocal of the last tube give me positive result. Okay, طيب, some people is argue about this method and say this is not give accurate result. So they develop different method to give more accurate result. It's called titration score. So in titration score, they're looking for the grade and give a score for each grade, then sum them together to know the titration score. So in sample number 1, okay, it was +4. So if it's +4, we will give them 12. If it's +3, 10. +2, 8. +1, 5. Okay, so then they sum it together then to see what's the titration score. So here in this case, 12 plus 10 plus 8 plus 8 plus 8 plus 5. So this is equal to 51. Okay. However, here we can see it's quite less reactivity. So here it's +3, so we give them 10. So to calculate the titration score, okay. So the titration score is 49. Okay. So by using if we use a titer only, we can say that sample 1 and sample 2 is the same, isn't it? لما استخدمنا طريقة التايتر العادية، okay, طلع عندي كأن sample 1 و sample 2 is almost have the same titration, isn't it? لأن كلهم عطوني 24. However, when we do the different or the alternative way and calculate the titration score, we can recognize which one have higher titer, sample 1 or 2.
Sample
Excellent.
1.
Sample 1. Excellent. Okay. طيب.
طيب دكتورة، عندي سؤال.
Yes.
متى نكتفي بالتايتر بدون السكور ومتى نسويهم الاثنين؟
على حسب البوليسي حقت البلاد بان. إذا كانت البوليسي الطريقة هذه تسوينها، البوليسي الطريقة الثانية تسوين الثانية. Okay. طيب. So this is, we will discuss it inshallah tomorrow. This is the procedure of antibody titration. We can do titration by tubes as we will do tomorrow inshallah. Okay, and or we can use it by a microcolumn by using a gel card. Okay, so we can see here. Can you recognize that it is here is strong, then start to decrease to become negative at the end. Okay, so we can calculate, for example, how much is it? Okay. Right. So we talk about titration. We talk how we can perform the test, and we will do it practical tomorrow, inshallah. طيب. The test we discussed, we have to do it before delivery. Okay, so at the beginning when the mother is come or during pregnancy. However, now let's move and discuss postpartum testing. So after delivery, what type of test we can do for the mother? Okay, so we can do if the mother, for example, is if the mother is negative, okay, and we have to know, of course, we have to give her a RhIG, isn't it? But we have to know if it's so we give her the first dose at a 28-week gestation, isn't it? Then again, we have to give her at delivery within 72 hours, if you remember. طيب, during delivery, we have to calculate. So usually here is 1 dose is enough. Here we will see, we have to know if it's 1 dose is enough or there are a large amount of fetal-maternal hemorrhage happens, so need more than 1 dose. طيب. So we have to do a Rosette test, and as we said, Rosette test is a screening test. Okay, so usually we do it, as we said, mother is negative and baby is positive. طيب, just imagine that after delivery we do that, we take sample from the infant or from the cord blood. ممكن ناخذ احنا sample من الcord blood, مو بس من البيبي، لأن الcord blood represent the baby. Okay, الcord blood كله تابع للبيبي مو تابع للأم. Okay, so we can take sample from the بس تحتاج procedure شوي يعني بعض الإضافات عشان نجهز السامبل من الcord blood. Because in cord blood there are Wharton jelly. It can interfere my reaction, so I have to do washing step, additional washing step to get rid from them. Okay. So, or we can take it from the baby vein يعني عادي. طيب, if we take sample and we do an ABO with D and we recognize the baby as negative. So do you think the mother to take the second dose of RhIG? وش رايكم؟ ما له داعي صح؟ ما له داعي. excellent. طيب, سوينا الRhIG.
تقصدين نيجاتيف إن دي نيجاتيف؟
إيه, إن دي نيجاتيف.
أوكي.
In this case there are no need, isn't it? ما له داعي نعطيها جرعة ثانية وإحنا خلاص الآن اكتشفنا إن البيبي أصلاً negative. Okay, so there are no need to give her the second dose. طيب, if we recognize لا, no, this baby is positive. Now, yes, we have to give her, but we have to calculate to know if 1 dose is enough or not. So we can do a Rosette test. As we said, screening. So if it's negative, خلاص 1 dose is enough. However, if it's positive, we have to do the other test, the confirmatory test, Kelhauer-betke acid elution test. Okay, or do flow cytometry, as we said. Now they develop flow cytometry. Okay, لأن هنا this is the standard method, but we will see it's take time. Okay, to calculate it. It's not easy. flow cytometer لو طبقوها تحولت إلى clinical يعني application routine use تكون عندنا أسهل و more accurate. طيب. So let's move to the infant test. So this is the mother test related to mother, Rosette test, Kelhauer-betke test. So we do that. So for example, if she have 600 milli of fetal-maternal hemorrhage, not 600, for example, 60 ml, that means she, for example, need 2 or 3. It's depend يعني فيها calculation خاصة 2 or 3 doses. طيب. إذن baby negative after delivery عشان أتأكد. We will do test for the baby. Okay, as we said, we will do ABO typing for the baby. Also, we will do D. Okay, so with D, if it's positive, we have to give the mother. We have to do a Rosette test and Kelhauer-betke test to know if 1 dose is enough or she need more than 1. Okay, لأن لما يكون عندي نزيف كثير ممكن 1 dose ما تكفي. فنتفاجأ بعد الولادة بفترة أنه طلع عندها الأنتي دي. طب ليش إحنا عطيناها RhIG؟ إيه عطيناها RhIG بس الجرعة كانت ما تكفيها. كان المفروض نعطيها أكثر من 1 dose. طيب عشان كذا ننتبه and we have to do this test. طيب we have to do the ABO test for the baby and also do D. طيب if we want to do the ABO we have to do direct and indirect. Can you remember?
No, only direct.
only direct لأن الدايركت يصير فيها مشاكل.
ايه بيصير ايش؟ ممكن يعطيني inconsistency، بيعطيني discrepancies. Okay, so لأن الانتيبودي we don't expect the infants to produce anti-A و anti-B، وحتى لو لقيناها عادة بتكون جاية من المother. Okay, طيب if we suspect, if the mother develop antibodies, okay, we suspect hemolytic disease of a newborn. Okay, so we can do that test. Okay, so this is indicator. So if we get that test, this is indicator that the mother antibodies is bind to the baby circulation and causing sensitized baby circulation, baby RBC. Okay, so we can recognize and detect that by using that. طيب. Sometimes بعض الأحيان يكون عندي that positive. Okay, that positive. والphysician for example يبغى بالضبط الphysician want to know what type of this antibody. اوكي كيف ممكن اعرف نوع الانتيبودي اللي مسبب لي that positive؟ اعطوني افكاركم. antibody identification. طب وش العينة بتكون عندي؟ لطيفة said we can do antibody identification. So what's this? What is my sample will be? Of whom? Baby or the mother? Okay, so we can do antibody identification for the baby. Okay, and if it's not available, we don't have serum from the baby, we can back to the mother. Okay, back to the mother and see. طيب sometimes لحظة 1 second. Let's see. طيب so sometimes the mother may have number of antibodies. Okay, sometimes the serum is not available. Okay, and sometimes so there are some condition the physician may ask to know the specificity from the antibody from the baby blood. How that come? Okay, so when we do that test for the baby RBC, we get positive result. So we can, so this is our BC of the baby. Okay, it's look like this, isn't it? So we want to know the specificity of this antibody. So in this case, okay, so you recommend for example using baby serum? Yes. Okay, we can maybe use a mother serum? Yes. However, we can also elute this antibody. What I mean by elute the antibody? What do you think? What does elution mean? Antibody identification of the mother. طيب دعد wash separate. Excellent. To be specific, Aisha said separate. We can elute or separate or remove the antibody. We can elute or dissociate the antibody from the red blood cells. So we want this antibody to become free antibody. How can we achieve this? By using elution technique. So by using elution technique, we can dissociate the antibody from the cell, okay, and it becomes free. So when it becomes free, we can do antibody identification. Run the elute. الحين بنسميه elute, okay. we can run the elute on antibody identification panel. بنشوف the specificity of this antibody لأن if it's bind directly to the RBC, we will not be able to know the specificity. So we have to dissociate this antibody. Okay, remove it from the RBC first to become free. So when it becomes free, we'll call it elute. Okay, so elute, we can test the elute against the antibody identification panel. طيب let's see now. بنشوف عندنا case study مرة حلوة صارت في خالد وزودونا في الريزلت وبنناقشها إن شاء الله. So let's back. I want you to know to see the result of Rosette test. So in Rosette test, okay, we will take sample from mother, sample from the mother, okay, after delivery, for example, or abortion or trauma or whatever. مو بس الولادة، أحيانا بعد التسقيط، أحيانا بعد حادث الله يقدر صار، توقعنا صار في نزيف في المشيمة. هذه الحالات نقدر نسوي روزيت تيست لأن إحنا نخاف مرة عليها أنها تديفلوب الأنتي دي. طيب ولا أقدر أعطيها كذا جرعات عشوائية، فأفضل طريقة أن نسوي لها روزيت تيست عشان نشوف، وبعدين كالهربتك تيست. طب let's see negative positive result. So here in positive result في روزيت تيست it's special يعني test the cells will be the D positive cell. اوكي اللي هي جايه من وين؟ من وين جاي الدي بوزيتيف سيل؟
من البيبي.
من الام. ايوه من البيبي will be surrounded with a special cell. Okay, will be surrounded with a special cell and give this appearance. Okay, so it give this appearance. So if we have number of these فيها يعني details شوي, but however in general when we observe a number of this rosette cells, that means the rosette test is positive. So which is mean that the bleeding is more than 30 ml. So the bleeding is الفيتوماترنال hemorrhage. هذا indicator أن الفيتوماترنال hemorrhage is more than 30 ml. So that means it may need or she have to take more than one dose of RhIG. طيب let's see negative result. شوفون negative result. I cannot observe rosette cells. Can you see? Is it clear in negative result? Slide اختفى. طيب I don't know. طيب just a second, I will see why it's disappeared. Yes, it's disappeared. I don't know. Just a second. ايه طلع. طيب صح طلع.
اي طلع.
ممتاز. So here this is a so here this is a positive result on the right. Sorry, in the left. This is positive result on the left, and here it's negative result. Is it clear the negative result? We can see the cell is free, so there are no positive cells. Okay, so this is indicator that the rosette test is negative. Okay, and this is positive. Is it clear rosette test? Okay, so in positive, this is, as we said, an indicator that it is it more than 30 bleeding more than 30 ml. طيب النيجاتيف يعني خلاص one dose is enough. هنا لا خلاص أنا كذا متأكدة إني أحتاج أكثر من واحدة بس ما أعرف بالضبط كم أحتاج فعشان كذا ننتقل للتست الثاني الكالهر-betke acid elution test. So here in this test we can quantify. Okay, so know the exact amount or amount of fetal-maternal hemorrhage. So the main principle of this test that we will use acid. Okay, the acid will elute adult hemoglobin. What is the adult hemoglobin? Can you remember what is adult hemoglobin? So we have 3 types of hemoglobin, isn't it? يلا remember 291. Okay, we have 2. Aisha, excellent. And Latifa. We have hemoglobin A, we have hemoglobin, okay, A2, and also we have hemoglobin, hemoglobin F. Okay, so we have, what's the most common in adult? Which the most common? الله لطيفة. أنت شاطرة. Hey, excellent. Okay, so hemoglobin F is adult, is the common in fetus, okay, or in newborn. So we will utilize this information now. So because we know that, okay, we know that the most abundant hemoglobin in adults is hemoglobin A, and the most abundant hemoglobin in fetus or newborn is F. We can utilize this information by doing this test. So in this test, we will use acid. The acid has the ability to elute hemoglobin A. However, hemoglobin F can resist the elution. So we can quantify number of fetus cells. Okay, so we can quantify the number of fetus cells لأن it will resist acid. It will not elute. So adult cell will be, after elution test, will be appear as ghost cell. Okay, because hemoglobin A cannot resist the acid. So by this way, we can count fetal cells, do calculation, and know the exact dose the mother need. Clear? Do you understand this the principle of this test?
بس وش الشيء اللي نسوي له calculation يعني السيلز نفسها ولا إيش؟
نبدأ نعد الفيتال سيل. اوكي، ما دخلت انا في الديتيلز، لكن بشكل عام نعدد الفيتال سيل. كم عدد الفيتال سيل مقارنة بالادلت سيلز، وبعدين نسوي كالكوليشن، وبعدين نحسب، يطلع لي حسبة كم عدد الفيتومتر، كم عدد البليدنج، كم كمية البليدنج اللي صارت. اوكي، فممكن تكون كمية البليدنج يعني وصلت مثلا، احنا قلنا ال1 dose it's enough for 30 ml bleeding. ممكن يكون البليدنج هنا عندي مثلا 70. اوكي، سو في الحالة هذه ما احتاج واحدة، احتاج 2، وعادة نزيد واحدة إضافية احتياط، نعطي 3 جرعات. اوكي طيب، excellent شهد. Elution. طيب خلاص، we understand now Rosette test and we understand Kelhauer-betke test، وقلنا ان نسويه لما يكون الريزلت عندي positive، لانه يعتبر الان confirmatory، ويعتبر will give me its quantitative test, so it will give me the exact amount. طيب let's move now to elution. We talk about elution and we said that if we elute the antibodies, that means we dissociate the antibody from the surface of the cell. Sometimes we use elution technique. For example, if we want to determine the antibody, okay, causing that positive result. Okay, فممكن يكون عندي cells is sensitized، أنا بعرف بالضبط what is the specificity of this antibody. So first we have to elute, then do identification test, like in this example. However, we can use the elution technique as a part, okay, فقط only a part of auto-antibody test, and we will see it now. We will discuss inshallah today. So So we will continue and now discuss the elution technique. So there are a number of ways. We can use it to elute the antibody from the antigen. Okay, so let's see now. So we have, as we said, there are a number of techniques can be used to elute the antibody from the antigen. We have acid elution technique, we have organic solvents, we have heat, we have freezing and thaw. However, the most common one is the acid elution technique. It is quite easy. It's quite easy technique and it's commercially available as a kit. Okay. لما يكون شيء عندك مصنع وجاهز تقدرين تشترينه هذا يسهل استخدامه. لأن أحيانا لا أنت تحضرين من نفسك الأشياء ما تلقينها جاهز وتشترينه أنت تحضرينه. فلما يكون جاهز يشترى هذا أسهل في التطبيق ويصير standardized. So here we have acid elution test. So we can here they used glycine acid. The main principle of this test is to reduce the pH. So we know that what's the physiological what's the optimal pH concentration on the test?
7 المفروض.
Extend the physiological pH. Okay, extend this is the physiological pH, which is around 7. So, and we know that the pH is very important factor for which step, for the sensitization step or for agglutination step or bridge forming step. What do you remember? Can you remember? Yes, excellent. Noura said it's the first step. Excellent. pH is very important factor related to first step. So physiological pH help the antibody. We know that the antibody is work usually at physiological pH. So if we provide this pH to the antibody, it will be able to bind to the antigen. However, if we change the pH, the antibody, and we know it is reversible step. Okay, so antibody can bind, but also can dissociate from the antigen. So here, if we change the pH, the antibody will be dissociate from the antibody, and that's what we are looking for. So in this, by using this way, so we said it's commercially available. It's keeping the integrity of the RBC. Okay, then it's not destroy RBC or destroy antibody. So it's a quite good technique. If you want to reuse the cells, you can reuse it. Also, we have different methods. We have, for example, organic solvent. Okay, for example, by using ether, it will affect the membrane of the RBC. So by affecting, we know that the antibody is glycoproteins or protein embedded inside cells, isn't it? تكون أشكالها مختلفة. Okay, so this is protein embedded on the lipid bilayer of the red blood cell. Okay, so by by affecting this layer, the antibody may dissociate from the antigen. Okay, يكون ماسك فيها بعد ما أنا أثر على الouter this layer membrane of the red blood cells. It will leading to dissociate the antibody from the antigen. Okay, الهيت it will affect. We know it's glycoproteins. Most of the antigen is glycoproteins. So by heating, the heating will affect the nature of the protein. It will change the structure of the protein. So as a consequence, it will cause conformational changes. بتغير عندي شكل الانتيجين نفسه. Okay, so this is leading to dissociate of the antibody. There are freeze and thaw. By using freeze and thaw methods, this is leading to lyse or destroy the RBC. تتكسر عندي ال RBC. However, we can dissociate the antibody. Usually, it may affect Okay, it depends on the antibody. It may affect, but in general, we can use this technique to dissociate the antibody, then use this antibody. Then use this antibody, and we expect them to work again. Okay. However, as we see now, it's affect red blood cell itself. But here it will. This is cause minimum destruction of on the red blood cell. Okay. إذن كلها بتساعد. All of these will be help me to dissociate the antibody from the antigen. However, they will affect the red blood cell, and the least one affected is the first one, الأسيد elution. Okay. طيب تذكرون لما قلنا احنا ما نذوب ونثلج وقلنا كمان هذا بتأثر مثلا عندي على البلازما. وكمان قلنا we don't put the red blood cell in freezer, for example, because this will lyse the cells. So yes, it will lyse the cells, and we can use this property to lyse the cells to dissociate the antibody from them. طيب, elution, as we discuss here, it can help to diagnose that positive situation or conditions. So that positive, it can be, we can detect that positive cells, especially in autoimmune hemolytic anemia patient, also in hemolytic disease of a newborn and fetus, and hemolytic transfusion reaction. Okay. Sometimes, if we want, just imagine that we have patient. So we already discussed these three previously. Okay, اللي هي حالات اللي فيها that positive. كمان sometimes here in point 4, sometimes the RBC ناخذ هذه قد صارت مرة. حالة جت مو قادرين يحددون الانتيجين على الريد بلاد سيل. ليش؟ قالوا ان لقينا السيلز حقت البيشنت that positive. اوكي مرة. فاحنا مو قادرين نحدد نوعه، مو قادرين نعرف ايش الانتيجنز اللي موجودة عليه. It's occupied by antibodies. So we want to remove this antibody. We want to get rid from this antibody in order to phenotyping or recognize the antigen on the red blood cell. Okay, so فسووا elution. بعد ما سووا elution, do phenotyping, and now they can recognize or determine the antigen present on the cell. So we have to remove the antibody from patient cells before we do the phenotyping. طيب, let's talk now about adsorption. We talk about elution, isn't it? Talk about elution. So in elution, we elute the antibody, isn't it? From the antigen. We elute the antibody from the antigen. So it becomes free antibody. طب, let's see what does adsorption mean. From your background, what does adsorption mean? لما نقول احنا قاعدين نسوي adsorption للشيء الفلاني.
adherence or increase of antibody inside the red blood cell.
Excellent. Okay, excellent. Here, so we want the antibody to, or whatever the substance, to adsorb on the surface of something, isn't it? So excellent. Here we want to adsorb the antibodies on the surface of the red blood cell. طب ليش احنا نبغى الانتيبودي adsorbed on the RBC؟ بنشوف الحين how we use this technique to help us to solve some problem. Okay. طيب, إذن الابزوربشن والإليوشن تعتبر quite يعني advanced technique, و it's not routine. مو شيء روتين إنك زي شغل كل يوم زي ال ABO typing والدات screening, identification. No, we have to do it at certain conditions only. So however, it's very important because sometimes we as we will see now, you may encounter with a problem, so we have to know how to solve these problems. طيب. So adsorption technique can be used when we deal, for example, with auto-antibody. تذكرون الauto-antibody؟ إن الauto-antibody can cause pan-agglutination, isn't it? On the identification panel, for example, نلقى it's all of the cells is positive, okay, or vast majority of them, okay. ممكن نلقى positive، أغلبها بتكون عندي positive. So this is sign of pan-agglutination. This is sign of auto-antibody. طيب، so تذكرون لما قلنا أن البيشنت ممكن يكون عندهم cold antibody وممكن يكون عندهم warm. طيب، cold antibody we talk about some technique. For example, we have to select some potentiator, not other. We can omit immediate spin. We don't do it. We can pre-warm السيرم. Okay, just a second. Okay, so if you remember, we talk about cold autoantibodies, and we talk about technique to solve the problem with which these antibody can cause. So we can get rid from or inactivate the cold antibody by omitting immediate spin, for example, or sorry. طيب. So this is method. I have to recharge my iPad. So this is different method. However, we also deal with warm autoantibody. So in this case, it will be quite complicated cases. So it's not like a cold, we can just come around it. Here we can use, it's quite hard to deal with people with autoantibody. So this is one way to solve the problem with these people. طيب، قلنا احنا دائما بترجع ان شاء الله. احنا قلنا دائما we usually afraid from a low antibody or autoantibody. Can you remember in the blood bank what we consider more, a low or an auto?
Auto.
Consider more a low antibody. Excellent. Okay, we don't want to transfuse the patient with antibody with cell carry antigen that this patient have a low antibody against, isn't it? لأنه بيسبب لي hemolytic transfusion reaction. الأوتو antibody جوا جسم المريض ما أقدر أتخلص منها، فما لها حل. وهي ما راح يعني تتفاعل مع donor cells زي ما تتفاعل مع البيشنت سيل، بتسبب مشاكل بس مي بكبيرة مرة. اوكي، اللي مو بيسبب لي مشاكل كبيرة مرة هو اللو antibody. اوكي، فأنا لازم إذا كان عندي بيشنت عنده اللو antibody وأوتو antibody، أنا ما أعرف طبعا، لأن الأوتو زي ما قلنا تذكرون شو تسوي ماسك. So it's mask اللو antibody. ف I have to get rid from these auto antibody in order to get rid from them or inactivate them in order to detect اللو antibody. طيب، one method أحد الميثودز المستخدمة، the most common or very important method is used الادsorption technique. Is to use الادsorption technique, and we will discuss it now, inshallah. Also, okay, so this is regarding to patient with autoantibody. Also, can you remember when we talk with people with a low antibody? قلنا if people have multiple low antibody, we can use different technique to identify or ruling out some of the antibodies. أعطوني بعض الأشياء اللي احنا درسناها. لما يكون عند patient عنده multiple antibody أكون أنا محتارة بينهم، أعطوني بعض التكنيكس اللي استخدمناها ممكن تساعدنا نحدد النوع. الإنزيم تكنيك excellent. selected cells excellent. Okay, وقلنا selected cells بيكون عندي looking excellent لطيف also. We have a red blood cell carry one antigen and lacking the other antigen that I expect the patient have a low antibody against. So by using this way, we will be able to ruling in or ruling or identify or ruling out other antibodies. طيب different way. بعض الأحيانا مثلا زي ما تذكرون قلنا اختيارنا للطريقة تعتمد على إمكانياتي أنا في اللاب. أنا في اللاب وش عندي؟ هل أقدر أستخدم هذه ولا أقدر أستخدم هذه؟ ولا البوليسي عندي تقول استخدم أكثر من واحدة؟ على حسب. فمن ضمن التكنيكس الادسوربشن. أوكي، هذه ما تطرقنا لها سابقا، الحين بس نتطرق فيها. طيب ذا سكرين والباك إن شاء الله soon. Okay, so we can use it to separate multiple antibodies. So بعض الانتيبوديز بنقدر حتى لو كانت اللو انتيبودي بنقدر نتخلص منها عن طريق تكنيك، نتخلص منها وبعدين نختبرها، مو نتخلص منها نرميها زبالة، لا نتخلص منها وبعدين نرجع نختبرها عن طريق الادسوربشن تكنيك.
مس يعني هي تعتبر مع الإنزيم والسلكتد سيل هذه طريقة يعني؟
إيه بس هذه شوي complicated، هي بسهلة يعني كثير. حتى شفت مستشفيات يقولك ما نسويها، ما نسوي يعني احنا نسوي الانزيم ونسوي selected cells. اما هذه تحتاج واحد عنده خبرة، مو اي احد يقدر يشتغل فيها. اوكي، فاحنا الحين بندرسها سوا and we will understand it ان شاء الله. طيب so here if I want to the screen is back now. So if I want to choose remove a low antibody, we will do a technique called auto-adsorption technique. Auto-adsorption technique. But if I want to use technique to create, as we said, multiple low antibody, okay, to help me in identify the antibody, we can use technique called low absorption. Okay. بس اليوم احنا we will discuss هذه. إذا أنتم بعدين تبوا يعني أي واحدة حابة بعدين، مو بالحين، حتى لو تخرجتوا بعدين وحابين تعرفون الطريقة هذه you can contact me, then we إن شاء الله able to explain it to you. طيب let's see now auto-adsorption. Auto-adsorption we use it to get rid from auto antibody. Okay, إذا هذه نستخدمها لما يكون patient عندي auto antibody وأنا أبغى أتخلص من auto antibody. طيب so first we will start with this. We will start with patient ناخذ منه عدة blood isn't it؟ بيكون فيها serum وفيها cells. So we want to know if the patient, we don't know if the patient have a low antibody or not. And we know that the patient have a low antibody. عارفين إن عنده auto antibody. طيب الحين الهدف من التست هذا is to get rid or removing these auto antibody. ويبقى عندي إذا كان موجود بس low antibody. طيب شوفوا إيش بنسوي. بنبدأ كذا صح؟ بنبدأ عندنا sample فيها فيها sample contain the auto antibody and the low antibody. So we can notice that this is this is the patient RBC. Okay, the patient RBC وفيها اللي ماسك فيها الأوتو antibody. Okay, ماسك فيها. لاحظوا اللو antibody is free. لأن ليش؟ لأن اللو antibody as we know it's against free or foreign antigen, isn't it? طيب so this is antibody. Okay. And we have this is a low antibody. Okay. طيب الحين first things we will do centrifuge. So first things we will do centrifuge. We want the red blood cell to go where? بعد السنترفيوج بتروح red blood cell will go down. Excellent. Okay, so it will go down. Sensitized cells will go down. والأب يطلع عندي some free auto antibody لأن إلا ما يطلع بعضها free وبيكون عندي كمان low antibody. Okay. طيب now I will separate them. Okay, and I will put this in a separate tube and this in a separate tube. Okay. إذن هنا عندي الأوتو أنتيبودي bind to patient cells. خلاص. وهنا عندي سواء كانت عندي اللو وكمان بيكون عندي الأوتو. طيب أنا كل شوي كذا بقدر. طيب وهذه الأوتو. طيب I will use الحين إيش بسوي؟ الحركة أني بستخدم البيشنت cell as a magnetic. كأنها مغناطيس تنظف لي تشيل أخلي أبيها تمسك كل الأوتو وتكبه ثم أنا أرجعها تشيل الباقي وتكبه. Okay, this is the main point. طيب الحين صار عندي cells sensitized cells. طيب أنا بفكهم عشان السيلز نفسها بستخدمها زي ما قلنا مغناطيس. الحين أنا بفك اللو أنتي بودي من بفك الأوتو أنتي بودي من البيشنت سيل. وش بسوي؟ وش اسم التكنيك سميناها؟
absorption.
لا بفكها I will elute. وش سميناها؟
Elutions.
أيوة سميناها Elution technique. أوكي ممكن نغير ال pH. أوكي وممكن هنا فيه special reagent called DDT. ال DDT راح يوخر لي السيلز بيوخر لي الانتي بودي. اوكي اذا ال DDT will remove الاوتو انتي بودي. اوكي اذا بتنفك الاوتو من السيلز نفسها. الاوتو انتي بودي الان بتتفكك. طيب بعد ما تتفكك هنا سوينا لها Elution باي دي تي سوينا لها Elution. بعد ما سوينا Elution صار عندي كذا برجع اسوي لها سنترفيوج. مين اللي بينزل تحت عندي ومين اللي بيكون فوق؟ تحت الار بي سي وفوق السيرم. اوكي الان السيرم وش فيه؟ او مو بالسيرم السوبرناتنت وش موجود فيه؟
الألو أنتي بوديز.
أوتو
اكسلنت. بيكون فيها شوف الالو ترى هذه البلو وان لحالها هنا بس احنا نشتغل على الاوتو. اذا بعد الدي دي تي it will dissociate from the it will be dissociate from the antibody will dissociate from the cell. Do centrifuge. The upper layer will contain the auto antibody. So this one I will discard. لأن auto ما بيهم صح؟ طيب لكن هذه ذكرون قلنا بنستخدمها as magnetic. طيب الحين هذه صارت free صح؟ free patient cell. شوفوها هنا free ما عليها ما عليها الاوتو انتي بودي لان خلاص احنا سوينا لها dissociate وديسكارد السوبرناتنت. طيب هذه now I will treat it with a special reagent called ZZAP. الZZAP هذه تشوفونها كمان اذا انتم تشوفون or if you refer to the blood bank guy website, it's really useful website and it's also funny website. However it's a trusted website. حاكين لك عن DDT, ZZAP and all of these. So even if you don't understand some technique, you can back to it and read it. Okay, it's really useful. حتى بعدين إن شاء الله إذا رحتوا بنك الدم خلوا الموقع هذا في بالكم دائما. طيب ZZAP it's reagent. It's contain DDT plus a certain enzyme. This reagent ZZAP will enhance the absorption of the cell. بيخليها زي ما قلنا magnetic. طيب إذا هذه برجع أستخدمها. الآن هذه وش بسوي فيها؟ الآن هذه الآن أبى أرجعها للتيوب هذا. أوكي؟ شوفوا كيف رجعتها للتيوب اللي هنا. هذا التيوب كان فيه 2 صح؟ كان في لسه تشوفون البلو هذا اللو ما لنا علاقة فيه. الأوتو أنتيبودي هو اللي أنا بدخل منه، كان لسه في بقايا، فأنا رجعت السيلز، رجعتها مرة ثانية واستخدمتها، رجعتها هنا. فهي it will absorb. لطيفة we talk about الأوتو أنتيبودي. So I will return it back عشان تاخذ بقايا الأوتو أنتيبودي. Can you see it here? This is the remaining. أرجعها عشان أستخدم بقايا it will absorb the remaining of auto antibody. Okay, it will absorb it. طيب بعدين again بنسوي لها centrifuge. again بنسوي لها centrifuge مرة ثانية زي كذا، بنسوي لها centrifuge. We will take take them from down. okay, and نتخلص من الأوتو أنتيبودي. إذا يبقى عندنا في السوبر ناتنت مين؟ خلاص الآن كل الأوتو أنتيبودي it's absorbed on the cell and I discard the cell. خلاص الحين يبقى لي إيش في التيوب حق البيشنت؟ excellent. يبقى لي آخر شيء can you see it here؟ آخر شيء يبقى لي، طبعا هذه إني آخذها وأرجعها ممكن أكثر من مرة. كل مرة أتأكد أنها، لما أتأكد أن بالفعل جميع الأوتو أنتيبودي I get rid from them. It's absorbed on the patient cell. Okay, إذا استخدمت patient cell as magnetic to take out all of the auto antibody. So if there are a low antibody, it will remain on the tube. Okay, الآن بنسميه adsorbed serum. الآن بتغير اسمه، بنسميه adsorbed serum. ذكرون هذاك سمينا اليوت، وهنا بنسميه adsorbed serum. طيب كل هذه العملية عشان بس أتخلص، كل هذه العملية عشان أنا أتخلص من الأوتو أنتيبودي. طيب شيماء ask when I use the Z-Zap. So I use the Z-Zap to after, so first time I use it to remove an antibody. I use it from the patient cell. I use it DTT عشان get rid from أنظفها كده، أطيحها اليوت cells. طيب الحين أبي أحولها، أزيد الانهانسمنت حق الادزوربشن، استخدم رياجنت ثاني اسمه زيزاب. ليش انا بزيد الانهانسمنت؟ عشان انا برجعها، ابي استخدمها از ماجنتيك، برجعها مره ثانيه للتيوب حق البيشنت اللي فيه بقايا من الاوتو انتي بودي. So reuse it again, it will absorb the remaining. Okay, so we can repeat this step several times until I get rid from all auto antibody. بنسمي الان هذا adsorbed serum. اوكي، اذا adsorbed serum نحصل عليه بعد شغل صح، لكنها however help us. طب الحين يصير عندي auto antibody. الآن I can do antibody identification test. لكن الحين الانتيبودي identification test راح نشتغل عليه السامبل عندي بيكون اسمها adsorbed serum، يعني مو سيرام عادي. إذا قلنا adsorbed serum نعرف أن الadsorbed serum هذا مر بعدة مراحل لما وصلنا له. clear؟ طيب last point الانترا-uterine transfusion، بعدين عندنا بسرعة بنمشي عليه، بعدين نشوف الكيس ستدي. طيب intra-uterine transfusion, blood for intra-uterine transfusion should be, what is the intra-uterine transfusion blood? So sometimes ذكروا لما قلنا ممكن الأم لما يكون عندها خلاص طلعت الانتي بودي، احنا just monitor pregnancy. الحين ما عاد نقدر نعطيها رقام ولا عاد نقدر نسوي شيء، الانتي بودي وطلع. فالحين اللي نقدر نسويه بس close monitoring، نتابعها عن قرب، نسوي لها titration وكذا. فلما الدكتور يبدأ خلاص يتابعها عن قرب، يشوف مثلا مستوى البيليروبين، يشوف يعني sign و symptoms معينة. أحيانا يصير يحتاج البيشنت أو الانفنت إلى transfusion حتى هو في بطن أمه. اوكي، يحتاج transfusion حتى لو كان في بطن أمه، فيحتاج سرتين we can do transfusion, intra-uterine transfusion. Okay. طيب intra-uterine transfusion we need special type of blood. اوكي ايش السبيشال تايب اوف بلاد؟ طبعا هو بلاد من دونرز لكن في بعض المميزات. So first it should be from group O. اوكي لان انا ما اعرف البيبي هل هو A هل هو B، ما اعرف لسه، ما اقدر اخذ من عينه وصعوبه ناخذ العينه، فلا ما نضطر ندخل في الكومبليكيشن هذه. و it should be from group O and D negative. okay it should be from group O and D negative. Okay, so this is because we cannot determine the ABO type of this patient, of the infants. طيب. Also, it should be fresh blood. What's the difference between fresh blood and old blood? So we know that we can keep the blood from 35 to 42 depending on the additive solution, so it can stay long time. So during this time it's okay to use the blood. However, for during this time في بعض التغيرات البسيطة اللي تطلع عندي في اليونت الادult can deal with it. However, the infants cannot deal with it. One of the most important variation or lesion can happen to the blood is leakage of potassium. Okay, so leakage of potassium. Potassium will be increased on this on the blood unit. It will be free on the blood unit. Okay, so high potassium level, it's okay. Adult can deal with high potassium level. We can tolerate that. However, the infants cannot tolerate high level of potassium. Okay, so this is why we have to choose fresh blood for them. Also, we have to irradiate the product, and we know that irradiation, previously we discussed the irradiation product. So irradiation product, the product is exposed to certain radiation. This will inactivate any virus or present of white blood cells. It will be inactivate them because what? Because we know that infants or fetus, sorry, are immune compromised, isn't it? They are too small. Their immune system is not developed yet. طيب cytomegalovirus again احنا صح تذكرون type of test we looking for hepatitis C, hepatitis B, AIDS virus. However, in intra-uterine transfusion we also should provide them with cytomegalovirus negative. Okay, cytomegalovirus اصلا هذا نسبته بسيطه لان احنا سوينا radiation وكمان سوينا filtration طبعا زي كلهم، لكن بالاضافه كمان احنا نخاف ان يكون عندهم cytomegalovirus. So donors نشيك عليهم لازم ب extra test or additional test looking for cytomegalovirus. It should be negative. Also, hemoglobin S should be negative. Okay, so it's in routine. There are no need to check donors, hemoglobin S in donors. However, if we want to give this blood to infants, we have also to do hemoglobin S test, and again, it should be negative. Okay. Red cell with hematocrit. So again, here in this point, we have to increase the hematocrit. Okay, so hematocrit, as you know from previous course, hematocrit is the percentage of RBC to the whole blood volume. So here it should be high. يعني أنا أبغى اليونت أغلبها blood، ما أبغاها جزء كبير منها فيها too much of plasma or too much of additive solution. I have to remove these, and hematocrit should be high. اوكي لان الجسم عندي صغير، فابغى الليكويد اللي اعطيه اغلبه دم، ما ابغى اغلبه بلازما اور وات ايفر، لاني ما اقدر اعطي له كميه صغيره، فانا ابغى كميه صغيره لكنها مليانه دم باكد RBC قدر ما اقدر، من طبعا 75 الى 80%، because I don't want I want this patient or this infant to benefit from this product as much as we can. We don't want too much of additive solution or plasma on the product. طيب. Okay, clear? Is it clear? This point?
Yes.
طيب. Finally, the donor cell should be the donor cell should be cross matched with patient with maternal serum. اوكي، لان ممكن عندها الانتي مثلا بالكي، فاحنا كمان لازم يكون compatible، لان كني بعطيه للام، لان اصلا الطفل جوا الام، والانتي بودي غالبا اذا كان عندها انتي بودي بينتقل للبيبي. اوكي، فانا ابغى ضروري يكون لما اسوي كروس ماتشنج ما اسوي كروس ماتشنج مع الانفنت طبعا، يعني ما عندي الدم ولا عندي السيرم تبعه، لكن انا استخدم الماترنال سيرم should be compatible. ما يكون عند المother antibody because this antibody against the donor cell, because this antibody it most probably will be present in baby circulation, so ما انحلت المشكلة، بالعكس بزيد المشكلة وبيصير احتمال عند the patient hemolytic transfusion reaction. So it should be compatible with mother serum. Okay.